What do therapists need to know to provide culturally competent care for Muslim American youth? There is a need to understand the perspectives of Muslim Americans to address the interpersonal barriers in seeking and utilizing mental health care. Barriers to access for Muslim Americans include Islamophobia and discrimination, and contribute to the distrust of providers and dropout in mental health care. So, there is a pressing need for culturally competent clinicians to work with Muslim American clients. We found that the Multicultural Social Justice Counseling framework and Locational Feminism can be applied to the Muslim American community to facilitate clinician cultural competency. To do this, we designed a phenomenological research study. We asked our participants what they needed in a culturally competent mental health care provider. We conducted 11 semi-structured interviews with Muslim Americans who were between the ages of 18 to 30 years in the San Francisco Bay Area. All interviews were 45 to 90 minutes long and in person, conducted by members of our research team who include non-Muslim and Muslim researchers, depending on the participant's preference. Participants were recruited through snowball sampling strategies, including techniques such as distributing flyers within mosques and local community centers, and actively collaborating with prominent leaders within the community and social media outreach. In terms of our findings, our thematic analysis identified 3 key themes to address cultural competency and working with Muslim American clients. The first theme illustrated that the identities of Muslims are complex, especially for Muslims in the U.S. who are developing adolescence. This included seeing each client for their unique constellation of identities, needing clinicians not to assume, but to listen, and to invite clients to define their identities, avoiding the use of a cookie-cutter approach, and recognizing the intersection of intergenerational and intercultural experiences of participants who are adolescents, and negotiating normative identity development. The second theme highlighted what non-Muslim American clinicians need to know when working with Muslim American clients. This included knowing that Muslim Americans live in fear and often have to educate and defend themselves in everyday situations, including in the clinical relationship. Additionally, domestic and foreign incidents of Islamophobia impact the mental and physical safety of Muslim Americans and in the therapeutic relationship. Clinicians also need to have some historical context and humility to educate themselves on mainstream society's attitudes towards Muslims, and to reflect on their own attitudes. The third theme emphasized what Muslim American clinicians need to know when working with Muslim Americans, which included being aware that Muslim American clinicians should not judge Muslim American clients due to different ways of practicing their faith. Recognizing that confidentiality and boundaries are especially important in communities that are as small as the Muslim American community. Lastly, clinicians should not assume that presenting issues have to do with lack of or inadequate faith. We have some quotes from participants that highlight these key themes. For example, in regards to the first theme of identity development, one participant shared that the uniqueness of being Muslim American, just understanding that every Muslim has an individualized history and an individualized personality is going to help mental health professionals deal with Muslims more effectively. In regards to the second theme, outside the Muslim community, a participant shared not stigmatizing their cultural practices and said, "I get that to a non-Muslim American therapist, an arranged marriage is not normal, but just because you think it's not normal, you can't link all of my problems to that. Because to me, it's very normal. In my relationship problem, the way that we met has nothing to do with it. You can't do that." The third theme, within the Muslim American community, another participant emphasized the importance of having a non-judgmental therapist and said, "It shouldn't be assumed that if a therapist is Muslim and the client is Muslim, that the solution has to be Muslim-oriented. The client should be able to choose." Altogether, from this study, we have learned that in order to improve clinician cultural competency with Muslim American adolescents, mental health care providers must recognize the complexities of Muslim American identities and differentially adapt their clinical care based on their roles as outsiders and insiders of the Muslim American community. What do therapists need to know to provide culturally competent care for Muslim American youth?